Welcome to another episode of MedMadness, where we dive deep into critical topics that impact both healthcare providers and patients. Today, we're discussing alcohol use disorder, a prevalent and often underestimated condition that can have severe consequences on physical and mental health. In this episode, we'll explore the key diagnostic criteria, clinical signs, and treatment options available for alcohol use disorder. We'll also delve into how this condition frequently presents in a primary care setting, often masked by symptoms like insomnia and anxiety. Finally, we'll share a real-life case study to help illustrate how these concepts come together in a clinical scenario. Next, let's discuss alcohol use disorder, or AUD. It is more than just heavy drinking. It is a chronic condition characterized by an inability to control alcohol consumption despite its negative impacts on one's life. The National Institute on Alcohol Abuse and Alcoholism provides clear guidelines to help identify risky drinking patterns. For women of all ages and men aged 65 and older, consuming more than 7 drinks per week or more than 3 in a single day is considered harmful. For men under 65, the thresholds are higher, over 14 drinks per week or more than 4 in a single day. In clinical practice, diagnosing AUD often involves looking for specific signs, abnormal liver enzymes. An AST-ALT ratio greater than 2. 1 is a classic indicator of alcohol-related liver damage, macrocytosis. This refers to enlarged red blood cells, commonly seen in chronic alcohol use. Alcohol tolerance. Patients may report needing more alcohol to achieve the same effects, a clear sign of tolerance impaired functioning. This can manifest in various ways, such as poor job performance or relationship difficulties. Next, let's consider a real-life scenario to bring these points into focus. A 45-year-old woman visits her primary care physician with complaints of persistent insomnia and anxiety, which she attributes to the stress of a divorce she experienced a year ago. Despite her intentions to reduce her alcohol intake, she finds herself drinking more frequently, up to 14 drinks a week. Her lab results reveal an AST-ALT ratio of 2.51 and a complete blood count shows macrocytosis. She also reports feeling increasingly reliant on alcohol to fall asleep, though she often wakes up in the middle of the night feeling anxious. Upon further questioning, she admits to missing work due to late nights of drinking. Given her symptoms, lab findings, and the impact on her daily life, this patient is diagnosed with alcohol use disorder. Her condition is likely contributing to her sleep disturbances and anxiety, common in individuals with AUD. Now, to conclude, in this episode, we've explored the critical aspects of alcohol use disorder, from its diagnostic criteria to the importance of identifying the condition in primary care settings. We also discussed how pharmacotherapy, particularly naltrexone and acamprosate, can play a vital role in managing AUD. Before we wrap up, remember to engage with our pre- and post-podcast quizzes to test your knowledge and reinforce what you've learned today. Don't forget to review our Anki flashcards for quick and effective study. Your commitment to learning is key to mastering these essential medical topics. Thank you for joining us on this episode of Med Madness. Until next time, keep learning and stay curious.